Welcome, everyone. My name is Maruf Khan, and I'm part of NIHR Global Health Research Center for Non-Communicable Diseases and Environmental Change. And it is my pleasure to welcome all of you to the fourth session of Voices of Practice series. Voices of Practice is a series that is being co-created with our public advisory board to listen to experiences, reflect, and learn what meaningful engagement looks like in practice. And in today's session, today's session, as some of you might know, is titled uh, "From Evidence to Action: How Data Shapes Real Policy Decisions." And we are honored to have Dr. Yanuar Nugroho with us for this session. Dr. Yanuar, he is a senior lecturer at Diyarkara School of Philosophy, Jakarta, and a visiting senior fellow at the ICIAS Yusuf Ishaq Institute, Singapore. He previously served as an academic at the University of Manchester and has held senior advisory roles in the Indonesian government, including Deputy Chief of Staff to the President. He has also led monitoring and evaluation initiatives for COVID-19 response, SDG coordination, and national development policy. He is the founder and the advisor of the Center of Innovation Policy and Governance and Nalar Institute. In today's session, we will hear from him based on his experience of overseeing Indonesia's priority programs, advancing open government initiatives, and coordinating national SDG implementation. Dr. Yanuar will try to unpack what happens after advocacy reaches the halls of power. So please join me in welcoming Dr. Yanuar. Over to you, sir.
Thank you very much, Maruf. Hello, everyone. I don't know where you are in your time zone at the moment, so probably good morning, good afternoon, or good day to all of you. Uh, well, Maruf has been very kind to give me an opportunity to share with you the real story or stories, probably, how we can use or how we can leverage the use of data in real policy decisions. I deliberately use the word real here because in this session this afternoon, this is not a lecture, not at all. It is just a sharing of experience, which is based on my role when I joined the government back in 2012, actually. So previously, I lived in the UK as an academic in the University of Manchester from 2000 until 2012. And then I was called back home by the President of Indonesia to serve him in the so-called President's Delivery Unit for Development Monitoring and Oversight. And then that was under President Yudhoyono. And then the regime or the administration changed, and President Joko Widodo assumed the office. And he appointed me to be the Deputy Chief of Staff to the President, one of the 5 deputies, in which I was responsible for around 2/3 of his development priorities. So this talk today, or this sharing today, is based on that experience. Just to quickly set up the context, the first context here is this is my understanding of policy-making processes and the role of research and data as someone moving from academia to the policy-making world, if I may say so. So often we think, or often we assume that I think okay. Often we think or we assume that good research based on robust data or methodology or approach would create or would help a good policy. But sometimes or oftentimes in my own experience, that is not the case. In Latin, there is this wording, non sequitur, or in English, it means not following, meaning that research or good research based on good data does not always follow or does not always create or inform so that the policy can be sound or can be, if I use the word good, loosely defined, appropriate, and that's often something that bothers me. So when I dig deeper into the problematic or into the challenge of policy making, and then I was helped by my mentor at Manchester at that time, Jacob Adler, who helped me to or who helped me understand the link between policy and the other two things, which are often overlooked by academics, which are politics and polity. When we talk about policy, it is about content. It is about substance. It is about mechanism. So what is done? What are the effects? That's policy, right? However, we need to also take into account the role of politics, which is the process by which policy is decided upon and implemented. But policy does not exist in vacuum. There is another thing called polity, which is the institutional framework, including political culture, in which policies are defined and implemented. This is where, actually, when we talk about evidence-based policymaking or the use of data, the use of evidence, we are talking about the polity. If the political culture is not there in the policymaking processes, no matter how good, how robust the data that you provide, they will never inform policy. So, I have few questions to reflect when we talk about research, which basically is about to what extent does research contribute to the policymaking process? So, in terms of policy, how can research be influential to the policy? How research can help shape content, substance, mechanism? That is the first line of the question. Secondly, this is now about the research and the people, the researchers. How can research and researchers influence politics? Some of us may still think or may think that as an academic, we should not go into politics. Well, that's right. We are academics, we are researchers, we are not going to politics, but we need to understand how politics work. Because otherwise, we cannot influence politics. Our research cannot influence politics. And the third one, the questions about how that our research can provide or even become polity. That the decision-making processes should be based on data, should be based on evidence, should be based on robust methods or approach. So this is the first context, if I may say, academic or conceptual context. The second context, because I'm going to share with you the story about Indonesia, is just so you get to know a bit better about my country, Indonesia. This is the country. This is the map of Indonesia. If you see it from the sky, that's Indonesia, right? Population of 285.7 million, economic growth around 5, GDP per capita around 4,900 US dollar, Gini coefficient 0.37, and so on and so forth. I put there. One of the biggest problem of Indonesia is inequality, as you can see from the picture. That is Indonesia at night. And you see, that's only Java Island. The rest of the country, well, you can see it. Only big cities in North Sumatra, in West Kalimantan, in Eastern Kalimantan, some parts of Sulawesi. Practically nothing in Papua, in Maluku, in Nusa Tenggara, in East Nusa Tenggara. This is the context. So we are dealing with a massive country with a vast number of populations, with a very challenging political setting. Electoral democracy with decentralization, direct presidential election, direct election for governors, mayors, and regents. But we have very big central government, 48 ministries with more than 100 ministers and vice ministers, and so on. So let me share you the first case. This is about the MR, measles rubella immunization in Indonesia. In 2017, so this is the real case that I was responsible at the time as a deputy chief of staff. I was responsible for health sector among many other sectors. I'm taking this case study. In 2017, the MR immunization in Java is this island here, the central, was successful. But the same campaign for MR immunization phase 2, which is outside Java, the rest of the country, was just below 70% of the target of 95%. And, of course, herd immunity, right? If we fail to achieve that, then everything risk to fail. So the phase 2 of the campaign targets almost 32 million children below 9 to under 15 in 28 provinces outside Java Island. And from 1st of August to 15 November 2018, a year later, the coverage barely reached 69.57%. So you can see that immunization was massively rejected by the society. The question is why? See, these are from the local newspaper. Strong rejection in Aceh, for example, caused the immunization to stop despite the very high prevalence of measles. The headline here reads, Aceh rejects immunization. Although BBC warned that Aceh is actually in the danger of being hit by a tsunami of rubella. In other newspaper, it says that MR immunization should wait for the instruction from the governor. So, what we did in the office of the president, the Ministry of Health, there is actually a misconception among the majority of populations of Indonesia that immunization is haram. We are mostly Muslim in Indonesia. And although there is no, at that time, there was no any teaching or fatwa from the Indonesian Ulama Council that immunization was haram, but that is how people understood immunization. So, as Deputy Chief of Staff, I came directly with the mandate from the President and from my Chief of Staff to go to the Indonesian Ulama Council and ask for their help. So, on 19th of August, the immunization is declared officially by the Ulama Council as mubah. Haram is something that you cannot, you should not, you must not do. Mubah is that you can do it. But this declaration that immunization is mubah is not, or was not as massive as the information that rejected immunization, because it was not clear whether it was halal or haram. Some interest groups strongly reject due to the belief that vaccines are haram. So there is a clear need for socialization. And you can see also the lead time between when the Council of Fatwa, Indonesian Ulama Council happened and when the document was released. So what we did was a massive campaign in Indonesia, everywhere. We work together with the Ministry of Health, we work together with the military, we work together with the police, we work together with the regional, subnational governments, and even we did not wait for them to come to the health centers or primary health cares, but we, the staff, the health workers came to them. That's what you can see there in the picture. And finally, after socialization, I took one case of one big city in Sumatra. Before socialization of MR immunization, there was a strong rejection even from the official government, major government. But after the socialization, the same newspaper, the same city changed the headline dramatically. This is for the sake of our kids, of our children. This is about the commitment of the state. However, we failed. We failed. Despite this campaign, we could not reach the 95% target. There was no herd immunity, so that we have to repeat all the immunizations in the following year, and it cost the country around 12 trillion rupiah in total, everything taken into account. So this is the story about the failure, despite that we use the data. First case. Second case. This is about malnutrition and measles outbreak in Asmat, Papua. In Asmat municipality, from September 2017 to February 2018, 72 children died, 651 children infected with measles, 223 children with malnutrition. And if you look at the data, if you look at the information, you look at the research, death rate in advanced societies is only 1 to 2 cases of 1,000 events, which is only 0.1% to 0.2%. And this decreasing rate of death is a result of increasing coverage of the MR immunizations. So we look closely to the case of Asmat. What caused measles outbreak? Coverage for basic immunization is less, health workers are very minimum and are not equally distributed, malnutrition. Average coverage is only 20%. There were only 13 primary healthcare with 7, still in Bahasa Indonesia, with 7 medical doctors, and underweight 30.3% with stunting 25.9%. And if we look closely at the research, the study told us that they all started from sanitation and clean water, which are not suitably available, access to transportation or infrastructure, which is very limited and extremely expensive in Papua, the eastern part of Indonesia, and also access to information and energy is minimum and unconducive nurturing pattern. This is what we know from research. This is not enough. So I sent my staff, 2 of them, and 3 with another one from other part of the office of the president. I sent them to Papua with my clear instruction: do not go back to Jakarta unless you find a solution or different data. And this is what they sent me. The reality that Asmat people live nomaden. They keep moving from villages to villages, and also in bivak. Bivak is big tent in the swamp areas. As nomaden society, they live in a rather unhealthy environment, and they depend their life on the nature and is still not able to cook and process nutrition optimally. They also work in the jungle or forest. Okay? And another data that I got directly from the field is that these pictures, which at that time were not in government repository, that in addition to Asmat tribe, the municipality, in the municipality also exists the tribe of Korowai, who lives in 3 houses. The Korowais live in 3 houses which could be 50 meters above the surface. They are also nomaden. So it is impossible to reach them. It is impossible to expect them to come to the primary healthcare. What we should do is that we need to come to them to provide the service. Based on the data, we created, and in my career, this is the largest task force that I have ever created and coordinated. This is the National Task Force. At the center, you can see Ministry of Health, National Police, and then the region of Asmat and the armed forces at the core. Okay? The red one. This is the task force. The task force cannot work alone. It needs facilitator in the yellow circle. Who are they? Ministry of Social Affairs, Ministry of Education and Culture, Ministry of Religious Affairs, Ministry of Village, because they are needed to empower people, provides aids, empowers people. Also, Ministry of Transport, Ministry of Energy, provincial government, because the government is needed to provide logistics and health workers. Ministry of Energy to ensure access and provision of oil and gas. And then Ministry of Transport is needed to ensure access to land, air, and water transport. That is the so-called supporter or facilitator. And then the other ministries which work as coordinator, oversight, or evaluation. Ministry of Finance, coordinating for long-term budgeting. Ministry of National Planning, coordinating of long-term improvement and planning. My office, Executive Office of the President, strategic monitoring and evaluation, improvement of governance of subnational governments done by Minister of Home Affairs, and coordinating Minister for Human Development and Culture for coordinating of quick responses and preparing long-term interventions. The result with that, 5 February, the region of Asmat issued a letter to the state to state that the status of measles outbreak has been revoked. So, this is now a success story. With robust data, but data alone is not enough. That data needs to be taken into policy actions involving those many ministries. And then we have national action, even though it is only for one municipality, because we need to do quickly to prevent more death. That is case number 2. Now case number 3. This is more at the meso level. Based on that, Indonesia was working quite hard in preparing the so-called digital strategy for the government. We call them in English it's e-government, basically. There are parts in e-government which is about map and about data. In the screen now, I'm showing you the so-called one map policy presidential regulation and its result after it was rolled out for 4 years. The goal of this one map policy is to create geoportal. We have database, we have reference, we have standard. So we have one geoportal database, reference, and standard, because Indonesia at that time, we did not have our own reliable map for development planning. You may not believe it, but that's what really happened in my country. Up to 2015, we relied on a map from other sources. Of course, we have the map generated by the military, by the Ministry of Defense, but that's not enough detail if we want to do development. The benefit of having this one map policy is that we will have geospatial data correction, we can have land use policy planning, evidence-based policy, and that requires some main activities: compiling geospatial data, integrating geospatial, the so-called superimposition to the reference map, and synchronize to ensure or to map where conflict happens in terms of land use. End of 2019, finally, we have 85 thematic maps. We have 18 ministries and agencies working on that, and 34 local governments. One case that we did is about corruption eradication in the natural resources sector through one map and one data policy. That is the map of Kalimantan. Forestry area in Kalimantan, total land area is 53 million hectares. Indicated area for forest is 69%, 36 million hectares. But in reality, the definitive area is only 19 million hectares. This is where the massive deforestation, or the most massive deforestation, happen in Indonesia. So even, for example, the office of the governor in East Kalimantan is built on the land, on the piece of land, which actually, in terms of status, should still be tropical forest. Can you imagine that? So the Indonesian Corruption Eradication Commission, KPK, they initiated the national initiative on the so-called corruption eradication in natural resource sectors. And then they seek for illegal practices in the sector by scrutinizing data which overlays in the map. So wherever there are overlays, they come there and they check. And then there was indication 70% of 11,000 companies listed in the natural resources sectors do not contribute to the state's non-tax revenue. Compliance of non-tax payment by rest of the firms, 30%, is also questionable. And they also found that business permits were given in conservation and protected forest, as much as 1.3 million hectares. Can you imagine that? Now, because we have one map policy, we can refill that. And this is what we did in the last part of the first period of President Joko Widodo. We created the so-called Executive Cabinet Dashboard for evidence-based policy. Of course, finally, the final decision should be with the president. So the data and all the tools we look at as decision-making support. So we have e-planning, we have e-budgeting, e-procurement, e-payment, and e-public services. The key backbone is they all have to be integrated and interoperable, meaning the data from planning needs to be able to be accessed for budgeting, for procurement, and so on and so forth. Okay, so 3 main questions. Number 1, this is my reflection. What must we do after learning all the evidence? And what I understand here is that we need to break the silo. And it has to start from the top or the center of the government. This is my office. Sitting next to me is the chief of staff to the president. You see my office, there is no cubicles. There is no small rooms where everyone has their own space. No, and I designed it deliberately. Everyone has to know what the other colleagues is working on. So when it comes into briefing the chief of staff to the president, instead of myself and my team coming to his office, I invited him to come to my office because we need to give him full picture of the process, of the problems, of the challenges that we are dealing with. Practically, I changed the practice of bureaucracy. Not a deputy reporting to the minister, but the minister comes to the deputies and discuss with them. Question number 2. Can policymaking learn from failures and expand from success? Yes. But there is a lot of work to do. These are the case of Indonesia. For example, transforming conditional cash transfer into the so-called Hope Family Hope program, meaning you ensure that conditional cash transfer is now done through online, for example, and then subsidized rice into non-cash food subsidy, again using the digital technology, but also reaching more people, and also national health insurance. So that is the second question. The third question, can governments get things done differently for the best interest of the citizens. Yes, but it needs hard work and commitment and ability to see the better versions of the future. So, why data and evidence matter in policy decision? Three things. One, to address the absence of coordination and siloed approach. Second, to address the so-called political bargain in the absence of evidence and ensure discipline in implementation. Evidence-based policy is needed to help coordination and break the silo. That's the first thing. Second, data and evidence is needed to promote, to push for evidence-based policy. The aim is to have better, more accurate, targeted public service delivery. And lastly, you need data to make sure implementation is as planned. And the aim here is for the government to have better decision-making processes. And this is my last message to all of you. Reforming bureaucracy or building state capacity, you do it always out of the box. Never business as usual, especially when you deal with complex problems. Again, on the left, this is the daily life in my office, in the office of the president. Everyone works. On the right, it was the informal meeting between three director generals. At that time, the president wanted to issue the land certificate, and there was a conflict between the Ministry of Environment, who can declare that a land is clean and clear, so that the Ministry of Agrarian can issue the certificate. Those two ministries are in conflict, constant conflict. So if I invited for meetings, if one DG came, the other DG deliberately didn't turn up. And I was tired of that situation. So finally, I invited both of them to a breakfast meeting. And things were discussed differently in breakfast, of course, compared to in the office. Over that breakfast, finally, we agreed on the solution. And that's the story behind the first land certificate out of 9 million hectares agrarian reform under Joko Widodo. And sometimes reforming the state, you can not always do it from within. On the left, that's me and the president after I completed the long-term development planning. He thanked me. And the same me, I was protesting the government because I think they didn't do their job. I was out of the government and I led the protest. So I think I will stop here and invite you for discussion or any comments. Thank you, Maruf.
Thank you so much, Dr. Yanuar. So I would request if people have any comments, thoughts, either you can put your questions in the chat or feel free to unmute and ask. And while people are thinking, Dr. Yanuar, I have a question that I wanted to ask, and which is particularly related to last part of your presentation, which talks about data. And I know that there are differences in the context when we say India and Indonesia. But in Indian context, sometimes when we talk about data, I've seen a lot of programs that eventually it becomes overload of data. And then the question about transparency and access of that data by the common public also becomes somewhat challenging. And those portals or those government websites of different programs, they present them in such complicated ways that a normal person who doesn't have very high level of statistical understanding won't be able to make sense of data in those terms. So how do you see this? I mean, how important it is for government to also ensure that data is accessible, transparent, and actually speaks to the public?
Wow. Different context, of course, Maruf, and forgive me, I do not really uh, uh, know that well the context in India, but I think your question is more on building understanding across government agencies or government institutions on the importance of data. And I think, Maruf, to be quite clear here, for example, the initiative for DPI, Digital Public Infrastructure, actually is quite active, and it was even for Asia, it was initiated in India, if I'm not mistaken, right? If I'm not mistaken. So I can see probably it is not a generic problem, probably. Again, correct me if I'm wrong, but probably it is more of the inequality of understanding of what you just mentioned about the importance of data for decision processes. I don't know whether it is comparable or not, but for example, if you talk at the village level, municipal level, and at the national level or provincial level, I can understand that there are some differences in the understanding of the importance of data. And that is more because people at the village level or at the municipal levels, they deal with a more, I would say, a more comprehensible data that they know the magnitude, they know the amount, they know the scale, right? So that they feel, okay, I have control to some extent over this. And as you move higher from municipals to provincial level, let alone to the national level, your grasp to the reality is less and less unless you have data. I think this is why there are differences in understanding the importance and even the urgency of having data, let alone data for decision-making processes. So, to me, there was no other way than keep building the so-called state capacity at all levels. I found myself, it was not easy for me to introduce the one map policy, for example, involving those subnational governments. The way I did that, Maruf, was to make the case that it is not just for the benefit of the central government, but also to the benefit of the regional government. For example, this is a real case. If I'm not mistaken, it was at the Central Kalimantan. It was not easy to involve them in the preparation of the one map policy because it will require maps from the regional or from the subnational governments. I remember when I first presented this idea, the way I presented it was more on the why it is important for national development planning. And I sensed the room, when I read the room, I couldn't find, convincing, not compliance, but convincing agreement. And then somehow I didn't know where it came from. I changed the tone. I changed the nuance. What I did was I told the governor, sir, if we can have this single reference for map, I think you can benefit, or this local government can benefit from mapping the lands which are conflictual in terms of land use. It will help you save time in solving or resolving the conflict. It will help you have better planning for your own development agenda in the region. So it is more about their interest and less about the national interest. That's how I think I could get their buy-in, Maruf. So sorry if I do not answer your questions, but that's just the my understanding of addressing this kind of differences in data literacy, if I may use the word, across government agencies.
No. This is actually helpful. I mean, it does give some insights. We don't know that there is a stark difference in terms of, even I talk about the population in between two countries,
Yeah.
but it is very relatable. There is another question from Astha in the chat, which is on the similar lines. She is asking, have you found any parallels between Indonesia and India? Any case you found to be relevant to the topic discussed today? Please do share your thoughts.
Wow. Maybe you can help me, Maruf. What do you think you can find it relevant to India? Because I'm not familiar with the Indian context. Maybe you can tell me something, Maruf?
So, I mean, I don't have a lot of insights into something, the case study that you have used in terms of immunization. A similar case study that I have read some time back was about when the government of India was trying to fight the spread of HIV, and they did launched a program in the metro cities, and for some reason in all of the metro cities except Kolkata, program failed. And the only reason that program succeeded in Kolkata was because the approach they had taken to involve the communities in the whole discussion from the very beginning, which was not the case in other metro cities. So this is one relatable point, but I mean, this case study goes back to many years ago, not very recent. So in terms of context, obviously we have certain similarities in terms the village government is placed in Indonesia, and then how national government functions. But like I said, the geography, the size, the population is totally different in India. So I'm not sure. I mean, if how much we can compare, and if so, it's totally. I mean, I don't know if you have ever come across to see any parallels in this case.
Okay. Well, I think thank you, Maruf. And I think taking from that, I think for something that needs to be dealt with at the national level, sometimes centralistic approach is needed. I'm not saying that everything needs to be centralized, but probably the case of COVID could shed some lights here. So we had during the COVID, we had two big problems. The first problem was about quarantine. So in the beginning of COVID, it was about the quarantine, whether we should have national lockdown or we should not. And there are arguments, pros and cons. Those who are against national lockdown argue about the economic growth, about the economic aspects, because the economy will slow down much more, and then there was no economic activities and so on and so forth, which is detrimental. The proponent for national lockdown argued that if we do not do this lockdown, the disease, the COVID, would spread much more quickly, and the government may not have time to deal with. And I remember, even after the president suggested, not instructed, but suggested not to have total lockdown, but only partial lockdown, some regions, some mayors in some cities in Indonesia, they did different, or they undertook different policy directives. I remember at the time in the newspaper, Tegal, for example, one city in the north shore of Java, north coast of Java, they didn't want to do this, or they did their lockdown, the whole city, causing vehicles that could not pass that city, for example. Based on that, then the president created or set up the national task force. So it is done centralistically from Jakarta to make sure that all areas follow the same instruction. This is the first part of the COVID story. The second part is in the vaccination. Learning from that, the vaccination is controlled directly from the center, especially the first and the second shot. The third shot, the booster, and the fourth shot were done based on the subnational government's policy. But for the first and second shot, that is totally centralistic fashion. But I think sometimes that's how some policies are implemented, Maruf. Not always ideal, but we deal with the situation. So sometimes it is situational rather than ideal.
Thanks.
Yeah.
There is another question from Firdaus.
Hmm.
Is asking, in many cases, empirical evidence and community voices are already sufficiently available, yet policy outcomes continue to reflect elite preferences more than public needs. So what, in your view, is the core problem rooted in weak advocacy, bias within the policy knowledge regime,
Yeah,
or
yeah.
rather in power structures that inherently constrain the translation of evidence into policy action?
Wow. Thank you, Firdaus. I think this is a very sharp and important question. My short answer is the core issue lies primarily in power structures. Saying this doesn't mean advocacy is weak or the policy knowledge regime is neutral. No, both matter. But in practice, they operate within boundaries set by power. In many cases in Indonesia, I don't know about in India, but I believe you may have similar cases. I think we are not lacking evidence or community voices. What happens instead is evidence competes with interest. And second, decisions are shaped through political bargaining rather than purely rational assessment. As a result, even strong evidence will only influence policy when it aligns with the incentives of those in power or it is supported by sufficient political or social pressure. And this is where I think advocacy remains crucial because it is not merely to voice concerns, but to reposition evidence, reposition data, so that it becomes politically relevant. When you do advocacy, it is not just voicing your concern, but you use the evidence, you reposition evidence so that it becomes politically relevant. At the same time, I think we must recognize that the policy knowledge regime is not neutral. It can filter, it can frame, and even constrain what counts as valid evidence. So, I think rather than choosing one explanation, we should understand the hierarchy. Okay? Power structures define the playing field. Okay? This is power structure. Define the playing field. Knowledge regimes shape what is considered legitimate. And advocacy determines whether evidence can penetrate both. Again, this is power structures defining the playing field. This is knowledge regimes shaping what is considered legitimate. And you have advocacy determines whether evidence can penetrate both. The real challenge, therefore, is not only to produce better evidence, but to build coalitions shift incentives, and create political momentum so that evidence can actually work. So, in short, I think evidence does not speak for itself. It speaks only when power allows it to be heard. That's it, my
Thanks.
answer, Maru.
Thanks. There is a hand raised from Riska. So Riska, maybe you can unmute and ask your question.
Thank you. Thank you, Maruf. Thank you, Pak Januar. Very grateful that I heard a lot of things that's about the policy and advocacy. Actually, I have a lot of question, but yeah, I try to what question first. We know that we have a lot of source data in Indonesia. Actually, we have like BPS, Bappenas, and from the ministry, we have a lot of data from the other resources, and the data we have different data from the others the different resources. So how we can address the discrepancies between data from different resources when we are formulating the policy. And the second question is about our research in EHR research. We doing a lot of things in the local level, and then we have a lot of data. Then based on the data, we create the intervention. And after the intervention, actually, when we talk about the PLB meeting and all and etc., actually, how should we communicate our research result to influence the policy? And maybe three questions. The third question is about the last one that you mentioned about the political momentum. How we can create the political momentum, and how we can get the political momentum for creating influence the policy. Thank you, Pak Januar.
Okay, wow, three heavy questions. Terima kasih, thank you very much, Bu
Yes,
Rika.
I think very interesting. Yeah,
Yeah, yeah,
yeah.
yeah.
Thank you.
Yeah. Can I answer it directly, Maruf, or what do you want?
No, go ahead.
Okay, so thank you, Bu Rizka. I think it's very practical and also important question, especially when dealing with the different data sources which have different data and how can you address them. I think let me start with a simple premise. And sorry if it doesn't make you happy. Differences in data are not an anomaly. Let me repeat. Differences in data are not an anomaly. They are structural reality. They arise from differences in definitions, methods, timing, incentives, and institutional mandates. So, and I think you will see this clearly. The mandates from BPS compared to mandates from think tank, the methods, the definition. Okay. So I think the question is not how to eliminate differences, but how to manage them for decision making. And probably I can offer you few reflections. One, we need to clarify what each data set actually represents. From BPS, for example, National Statistics, or from Research Center, or from think tank. Before choosing which data to use, we must understand the definitions. For example, who is counted? How? We need to understand methodology. Is it survey or is it administrative data? we need to understand timing. When was it collected? Like, for example, the debate between National Registry and the DTKS, the Social Welfare Database. It is about the timing, when it's updated, when it's collected. And I think often, actually, those differences are not contradictions because they are measuring different things. Definitions, methodology, timing. This is my first reflection. My second reflection is we need to establish a hierarchy of data for policy use. Not all data should be treated equally. As far as I understand, the government needs a reference data set. For example, official statistics. Why? Because they need it for consistency and accountability. The other things that the government needs is complementary data. Complementary data can be big data, program data, local data, or and so on and so forth. For what? For granularity and responsiveness. This is where initiatives like One Data Policy become critical. Not to eliminate diversity, but to create interoperability and standards. The third, this may not sound interesting, but you need to triangulate rather than choose. Because good policy does not rely on a single data set. If different data sets point in the same direction, of course we can act with confidence. But if they diverge, the signals where I think when they diverge, it signals where deeper investigation is needed. Why it is different? Why the number from Central Statistics and the Logistic Agency in the number of, on the amount of rice saving in Indonesia, rice deposit in Indonesia, is different. When it is different, it signals you need to investigate further. And finally, you need to decide, despite that the data is imperfect. You cannot wait until you have perfect data, because policymaking requires the ability to act under uncertainty, transparent about assumption, and adjust as better data becomes available. So the goal is not to have one perfect data set, but to build a system that can integrate, interpret, and act on multiple imperfect data. And the most important mindset, probably, Buriska, is disagreement in data is not a problem to hide. It is a signal to understand. And your second questions, how we can create intervention, evaluate using from the local data from your research. I think the practical way to think about it is this following. I think first, you need to shift from reporting findings to framing decisions. Remember, Buriska, Maruf, policymakers, they are not asking, what did you find? They're asking, what should we do given constraints? So instead of presenting data as results, translate the data into clear problem definition, policy option, and trade-offs and implications. Because evidence becomes influential when it helps decision makers decide. Second, speak the language of policy, not only of research. It means concise, structured, link the findings to existing government priorities, programs, or budgets. Especially now we have budget cuts across Indonesia, showing visibility, not just desirability. Technically, strong study that ignores institutional reality, I don't think it will go well. Third, engage with the government early, not only at the end. Do not wait until your research finishes and then you engage with them. No, engage early. Because if communication happens only after the research is completed, it is often too late. So, involve policymakers during design and iteration, or at least create ownership of the problems and evidence. Because I think this is just natural. People are more likely to use evidence that they feel they are part of. Number 4, I think you should use narratives alongside data. Not just number, but stories, life experience, concrete case. Number 5, you need to identify the right entry point. Who has the authority? Who are the policy brokers? When is the policy window? I think you need to find the right entry. And finally, be prepared to repeat for iteration. Because policy influence is never a one-off event. It requires repeated engagement, adaptation of messages, and sometimes strategic patience. And lastly, your question on the how we create political momentum to influence policy. To be frank, this is very, very difficult questions to answer. But practically, one, turn an issue into a shared problem, not just a technical finding. For example, about waste. It is not just about waste as a shared problem. It's not just a technical finding about waste, but it is a shared problem, how we deal with waste. Second, build a coalition. Do not act alone. You need to have friends, bureaucrats, advisors, civil society, media, influencers. They will help you create the momentum. Third, you need to align with incentives of decision makers. For example, is this issue beneficial for the governor or for the region? For example, you are dealing with waste or with pollution. How can this benefit politically to the power bearer? Number 4, use timing. Again, remember the crisis, budget cycles. Now that we have budget cuts, efficiency, maybe this creates momentum in itself. I think that's what I can share with you, Purisa. Thank you.
Thank you. Thank you. Thank you.
Thank you, Dr.
So
Yanuar,
good.
for sharing such a strong case studies and giving a deeper insight into about the reasons of its failure and success, and then responding to these questions that have been shared with us. And thank you everyone who have joined today for your participation and thoughtful questions. We had a great round of discussion, and I know that we ran out of time, and there are still 2 unanswered questions in the chat. But if you have more, you can always share your questions with me, and I can come back with the responses from Dr. Yanuar. As we know, that Voices of Practice series is about learning together, and today's session actually challenged us to think beyond generating evidence and towards designing pathways that help it travel from communities to corridors of power, and how data actually shapes real policy decisions. So thank you, Dr. Yanuar, for grounding this journey in real practice. We look forward to welcome you all to the next session of this series. Till then, take care. Bye. We will now close this session.
Thank you very much, Maruf, and everyone. Hope was useful. Thank you.
Thank you.
you.